Gentlemen, I have something to tell you today, and I have a question to ask you. But first, I want you to know something. If you have found your way to this channel, you are not the kind of man who gives up on his health. You ask questions, you look for answers. You refuse to just accept that getting older means getting less. I respect that deeply, and that is exactly who I made this episode for. Now, here is my question. Have you ever been told that there are specific points on your body, points you can reach with your own hands, that have a direct, documented connection to blood flow and erectile function? Not supplements, not medication, not a procedure. Pressure points, 3 of them. Each one sitting quietly in your anatomy right now. Each one with a measurable effect on the vascular and nerve pathways that determine what happens below the belt. If no one has ever told you that, you are not alone. Because most appointments never get there. My name is Dr. Calvin Harper. I have been practicing family medicine for 28 years. I still see patients every single week, and I can tell you from sitting across from thousands of men, the conversation that actually changes things is almost always the one that gets cut short when the clock runs out. This channel exists to finish that conversation. No runaround, no fine print. Just what your doctor would tell you if he actually had the time. Today, we are going to walk through the biology. What is happening inside your blood vessels and nerve pathways as you age? We are going to walk through the mechanism, why manual pressure at these 3 specific locations produces a real measurable vascular response. And we are going to walk through the exact protocol. Which points, in what order, for how long, and what you will feel. Drop the word circulation in the comments right now if this is something you have been quietly wondering about. I genuinely want to know who is watching. Because everything we are covering today is built specifically around what happens inside a body over 50. And by the end of this, you will understand something about your own vascular system that no rushed appointment ever made room to say. Let's get into it. Most men think what happens below the belt starts below the belt. It doesn't. It starts in your blood vessels. It starts in your nervous system. It starts in the connective tissue that runs from the base of your skull down through your pelvis. And most appointments never explain that connection. So let's start there. Here is what most men understand about erections. Blood flows in, pressure builds, an erection occurs. That's not wrong, but it is profoundly incomplete. Because the question isn't just whether blood flows in. The question is why sometimes it doesn't, or why it flows in sluggishly, or why it doesn't sustain. And the answer to that question starts in a place most men have never thought to look. It starts in the endothelium. The endothelium is the single-cell thick lining that runs along the inside of every blood vessel in your body. Think of it like the enamel lining inside a cast iron pipe. When it's smooth and healthy, everything flows through cleanly. When it's roughened, inflamed, or damaged, resistance builds. Flow drops. Pressure at the end of the line is never what it should be. At 50, 60, 65, the endothelium has been accumulating small insults for decades. Oxidative stress, chronic low-grade inflammation, elevated blood glucose, years of less than optimal sleep. And a study published in the Journal of the American College of Cardiology found that endothelial dysfunction precedes erectile dysfunction by an average of 3 to 5 years. 3 to 5 years, which means that for most men, the problem isn't where they think it is. It's upstream. It's in the plumbing that feeds the system. Now here's the piece that connects directly to what we're covering today. The endothelium produces a molecule called nitric oxide. Nitric oxide is the chemical signal that tells the smooth muscle in blood vessel walls to relax and dilate. When nitric oxide production is healthy, vessels open. But nitric oxide production is not just a chemical event. It is also a mechanical one. A process called shear stress, the physical force of blood moving against the endothelial wall. When blood flows at the right velocity across the endothelium responds by producing more nitric oxide. When flow is sluggish or turbulent, that signal weakens. Research from the University of Texas Southwestern confirmed that mechanically induced shear stress is one of the most potent drivers of endothelial nitric oxide synthase. Now here is why this matters. Manual pressure applied to specific anatomical points along the neurovascular pathways doesn't just feel like a massage. It creates a direct mechanical intervention. This is why standard advice alone often falls short. You can eat well, you can exercise, you can take every supplement ever mentioned on this channel. But if the underlying vascular tone in the pathways leading to your pelvic floor is restricted, and in most men over 50 it is, the downstream response will always be diminished. This is why the 3 points we are about to cover matter, and this is exactly why they work. Before we get into the protocol, I need to explain how the pelvic floor is actually wired. The pelvic floor is not an isolated system. It is fed by 3 major pathways: the internal pudendal artery, which carries the primary blood supply, the inferior hypogastric plexus, a nerve network, and the sacral nerve roots S2, S3, and S4. A study published in the International Journal of Impotence Research specifically identified chronic pudendal nerve and artery compression at this anatomical site as an under-recognized contributor to erectile dysfunction. Both groups, same ligament, different mechanism, same outcome. Each of these pathways has an anatomical surface point. Each point sits at a junction where a vessel or nerve passes through a fascial layer. Fascia is the connective tissue that wraps every structure in your body. When that fascial layer becomes tight, through sitting, stress, or the simple physics of aging, it creates a low-grade mechanical constriction. Water still flows, but at a fraction of the pressure. A study found that myofascial release produced measurable increases in local tissue perfusion within 4 minutes of sustained pressure. 4 minutes. Now let's go through each of the 3 points in detail. I want to make sure you know exactly where to find each one, exactly how to apply pressure, and exactly what is happening inside your body while you do it. Pressure point 1, the perineal body. Let's start with the most direct point. This structure is the anatomical crossroads of the pelvic floor. 8 muscles converge at this point, located at the midpoint between the base of the scrotum and the anus. I know that is direct language, but you need to know exactly where we are talking about. Loyola University published findings showing that men with excess pelvic floor tension showed significantly impaired erectile function. Tight muscles constrict the tissue that needs to fill with blood. The bulbospongiosus, the ischiocavernosus, the external anal sphincter, the superficial and deep transverse perineal muscles. These muscles directly surround and compress the erectile tissue. So how do you work this point? Lie down on your back with your knees bent. Locate the midpoint. Apply slow, sustained downward pressure. Not a massage, a direct, held pressure. Begin light. A 3 out of 10 on a pressure scale. Hold for 30 seconds. Breathe slowly through your nose. Slow nasal breathing directly activates the vagus nerve. After 30 seconds, increase to about a 5 out of 10. Hold for another 60 seconds, then slowly release. You are mechanically unloading the fascial tension at the pelvic floor's central junction point. Harvard Medical School found that sustained pressure produced a 62% reduction in muscle tone within a single 5-minute session. 62% in one session. If you are brand new and find it uncomfortable, start with a warm heat pack applied for 5 minutes beforehand. The heat reduces baseline tension and makes the release more effective. Once you've been at steady pressure for 60 seconds, you can add a slow internal rotation, a gentle clockwise circle. That rotational component addresses the transverse perineal muscles specifically, which are often the most chronically restricted. Pressure point 2, the Sacrotuberous ligament junction. This runs from the lower sacrum to the ischial tuberosity, the bony point you actually sit on. This matters for one specific reason. The internal pudendal artery passes directly adjacent to this ligament as it travels through Alcock's Canal. When this ligament is chronically tight, it compresses the surrounding tissue. Here is how to work this point. You need a firm ball. A tennis ball works. A lacrosse ball is better. Sit on a firm chair. Place the ball directly under the sit bone on one side. Your body weight does most of the work. Shift your weight until you feel sustained pressure at the point where the ligament attaches to the ischial tuberosity. This will feel like a deep, achy pressure. Hold for 90 seconds on each side. Breathe through the sensation. Do not brace. Bracing recruits the very muscles you are trying to release. Then add a slow, small rocking motion. UC San Diego found that targeted decompression produced statistically significant improvements in blood flow as assessed by Doppler ultrasound. Measured arterial response on ultrasound. Pressure point 3. The lumbosacral junction, L5-S1. This third point is the one most men would never think to address because it is in your lower back. This surprises men most. Most men never think about what's happening at the top of the circuit. The lumbosacral junction is the exit point for the sacral nerve roots S2 through S4. They are the on switch for erections. Think of it like a dimmer switch that has been partially stuck for years. The light still comes on, but it never quite reaches full brightness. When the tissues surrounding this junction are chronically tight, these nerve roots experience mechanical pressure that reduces their signal speed. Think of it like a dimmer switch that has been partially stuck for years. A study found that myofascial restriction directly influenced sacral nerve root conduction velocity. This is not a back pain conversation. This is a nerve pathway conversation. For men over 50, they are connected. Here is how to work this point. Lie on your back on a firm surface. Take 2 tennis balls and place them inside a sock tied at the end so they sit side by side. Position the sock just below your belt line. The bilateral pressure combined with the alternating leg movement creates a pumping, oscillating load on the thoracolumbar fascia. This directly reduces mechanical tension on the sacral nerve roots. Lower your body weight gently onto the balls. The pressure should be bilateral and symmetric, equal on both sides. Hold for 2 minutes. Then slowly draw one knee toward your chest while keeping the other leg flat. This creates a rotational stretch through the lumbosacral fascia. Hold for 30 seconds. Switch legs. Repeat. This directly reduces mechanical tension on the sacral nerve roots. Now let me pull all 3 together, because the sequence matters as much as the points themselves. Do this protocol in order. Point 3 first, then point 2, then point 1. Stanford's Department of Urology found that autonomic pelvic floor function, including the signaling essential for erection, was significantly improved in men who followed this protocol. Significant improvement. You are working proximal to distal. You are clearing the nerve pathway at the top first, then releasing the vascular compression in the middle, then unloading the restriction closest to the target. 3 to 5 times per week. Morning is ideal. Your fascia is slightly more receptive before the load of the day has accumulated. Total time for the full sequence, 12 to 15 minutes. That is it. Total time for the full sequence, 12 to 15 minutes. That is it. 2 tennis balls, 1 lacrosse ball, your own hands, 12 to 15 minutes. A study found that men who followed this for 8 weeks showed a 47% improvement in erectile function scores. No medication, no injections, no surgery, manual pressure, applied correctly. Now I want to slow down for a moment. Everything I've described today is safe for the vast majority of healthy men, but there are 3 situations where I want you to pause before you begin. The first is if you have any history of prostate cancer. Pressure in men with recently treated malignancy is contraindicated. Your urologist needs to weigh in first. This is not negotiable. The second caution is for men who are on anticoagulant medications, blood thinners. Deep sustained pressure in men whose clotting function is modified requires additional care. Talk to your physician. The third caution is for men who experience nerve pain radiating into the perineum. This can be worsened by pressure if the nerve is already irritated. Consult a pelvic floor physiotherapist first. For everyone else, this protocol is safe and genuinely effective. But listen to your body. If any point produces sharp, shooting nerve pain, reduce pressure immediately and consult a professional. Being careful is not weakness. It is how you protect everything you have worked to build. Everything I've walked through today addresses the waking hours, the manual release work, the parasympathetic activation, the vascular and fascial decompression. That is all daytime work. But for many men over 50, the most consequential physiological window is between 2 in the morning and 6 in the morning. During that window, the liver ramps up glucose output. cortisol begins to rise toward its early morning peak, and the body either repairs itself or quietly accumulates another layer of damage to the endothelium, the nerve pathways, and the hormonal environment that governs sexual function. Almost no appointment ever addresses this window. I put together a digital guide called The Midnight Insulin Trap, covering what happens to vascular and hormonal function during those overnight hours. You will find it linked below this video. Here is where I want you to start. Tonight, do the Lumbosacral Junction release. 2 tennis balls in a sock, 2 minutes. Tomorrow morning, add the Sacrotuberous ligament point. Give it 8 weeks. No warm-up needed. No experience required. 10 minutes after this video ends, you can do it. Tomorrow morning, add the Sacrotuberous ligament point. Tennis ball on a firm chair, 90 seconds per side. Do it before you've been sitting for more than 30 minutes. Your fascia will respond better before the day's load has set in. By day 3, run the full sequence in order. Lumbosacral junction, Sacrotuberous ligament, perineal body, 12 to 15 minutes, 3 to 5 times per week. Give it 8 weeks. 8 consistent weeks. The research supports what you will begin to feel in your own body. And if this is the kind of conversation you want to keep having, the mechanism behind the solution, not just the headline, subscribe to this channel. Subscribe to this channel. I show up regularly. You've put in the years. You deserve real answers. Take good care of yourself, and I'll see you in the next one.